Hey, everybody, welcome back to another episode of Confessions of a Male Gynecologist. I am your host, Shawn Tassone, America's Holistic Gynecologist and author of the Hormone Balance Bible that you can get now. I think right now it's about 40 or 50% off on Amazon. It's like $14. So run on over there and get it. Somebody asked me today, where do I start? Like, where's the first place? You got a podcast, you got a YouTube channel, you're on Instagram all the time. And the question was, where do I even start? I would say get the book. And I know that sounds like a shameless plug. Maybe it is. But at the same time, I do think it's a good place to start. What I want to talk about today is something that is near and dear to my heart. And that is what I would call the patient's Bill of Rights, or the Hormone Bill of Rights. When you go to a doctor, what you should expect and how you should be treated. And if you don't hit these criteria, then I would find your help somewhere else, because these doctors aren't here to help you. And basically what I mean by this is that there are things that you should expect from a physician, from a nurse practitioner, from a physician assistant. I can't speak to the ethics and professionality of coaches and whatnot, because I am not one. But when you see a provider, this is what I think you should do. And this is what you should expect. You should expect to have safe, considerate, and respectful care provided in a manner consistent with your beliefs. Now, I don't care who you are or what that means. Now, keep in mind, the provider also has their own belief structure, and they may believe something different than you, which isn't bad. It doesn't make them a bad person, but it may make for a bad fit for you. So you want safe, considerate, respectful care provided in a manner that's consistent with your beliefs. One, that makes you heard. Two, that makes you feel comfortable with the person that's providing care for you. You should expect that all communications and records pertaining to your care will be treated as confidential to the extent permitted by the law, meaning you have a HIPAA, a right to confidentiality. These providers shouldn't be talking about your cases with other people unless you've given them permission, or if they've redacted your personal information from it. I'm in a few Facebook groups where people will ask questions about cases, and they always take the patient's name off of it. So that's done in a legal way. But if you feel like you're being belittled because of your care, or if they talked to your husband and you didn't want them to, or they've talked to another doctor and you hear about it, that's not appropriate, and that should never happen. You have the right to know the physician responsible for coordinating your care at the clinical center, meaning if you're seeing a nurse practitioner or a PA or somebody that is what's considered a mid-level, that's, I guess, a little bit of a derogatory way to refer to them, but that's how we refer to them. You should be able to contact the physician. So if you don't like the care you're receiving and they have a physician supervisor, then you should be able to access that provider. In some states, those people, like nurse practitioners, don't need a supervising physician, so they're it. Most states require physician assistants to have a provider that's supervising them. So you should have the ability to contact that doctor. And if you ask, like, hey, can I contact your supervising physician? They should acquiesce to that. If you feel kickback, or if you feel like they're being derogatory because you asked for that, then that's a red flag. You should have a right to receive complete information about your diagnosis, your treatment, your prognosis, in terms that are easily understood by you. And if it's medically inadvisable to give information to you, it will be given to a legalized representative. Basically, you want to walk out of there knowing what the diagnosis is, what the treatment is, and what the options are. If you don't feel like you're getting those answers and you have asked multiple times, then that's not appropriate care. You can always go to another doctor and request your records, because the information that's in those records is yours and yours alone. The actual record is the doctor's, but the information is yours. And they should share that information with another physician or release those records to you, and then you should get another opinion from another doctor. You should receive the information necessary for you to give informed consent prior to any procedures or treatments, including a description of the procedure or treatment, risks, benefits, and any other potential alternatives, except for if it's an emergency, obviously, and you can't understand anything. What that means is, like today, for instance, I had 3 patients come in who were getting a pre-op visit for surgery that I'm performing tomorrow. They need to know the surgery that we're doing. We need to agree on what's being done to them, what's being removed, what's not being removed. We need to talk about the way that it's being performed, the options that they have, what to expect after the surgery and recovery. How do they get in contact with you afterwards? What's going to be the care plan afterwards? That if anything's removed from the body, it's going to pathology for a diagnosis, and that they will be advised of those results, and that they need to sign that consent form knowing and feeling comfortable that they have been given all the information. Now, I will tell you, a lot of people don't read the consent form, and I talk them through the whole thing before they sign it. Maybe that's why they don't. But I would encourage you, if you're having surgery, to actually read the consent, because the doctors do take the time to put that out. But if you are having a procedure and you don't feel like you got the information that you need, then by all means, ask more questions. I've been involved as a medical expert in a couple of cases, and it always comes down to consent. Sometimes patients don't understand, the doctor didn't say it very well, but it should be given to you on a level that's understandable by you. They shouldn't be throwing, like, I would say, we're doing a total laparoscopic hysterectomy and a bilateral salpingectomy. Sign this. Well, that's not great. Total laparoscopic hysterectomy means I'm using cameras, I'm using laparoscopy equipment, and I'm removing the uterus and the cervix. That's total. Doesn't mean ovaries. That's a different word altogether. The bilateral salpingectomy, bilateral means both sides, and salpingectomy means removing the tubes. So we would be taking out the uterus, the tubes, and the cervix. So the patient has an understanding. But if I just threw that out there, total laparoscopic hysterectomy, bilateral salpingectomy, you may not understand what I'm talking about. You should have the right to receive routine services when you're hospitalized at a care center in connection with your protocols and other conditions reported to you. So meaning, you should have access to all the care that you require. Now, as a woman, that's tough sometimes because you might be in the hospital for, say, an incomplete miscarriage. And maybe you can't get the care that you need, which would be a D&C or a termination, because that would help you. And the state that you're in may not allow that care to happen. I'm not one to get political, but that sort of makes me a little upset, because as the physician, I may know what the patient needs. She may agree with what the plan is, and then we are stuck because of the Congress people that have changed the laws, and I'm now having the medical care taken out of my hands. That's a rarity, obviously. But if you go in for an emergency for whatever reason, you should know that you have options and what the care plan is going to be. You should know in advance what appointment times and physicians have available. So, like, you should know when you come see me, patients will ask, like, what is this going to look like? Oh, I don't know. No. Basically, what I'll say is, okay, well, let's say it's for hormone. I'll see you for this first visit. And then if I prescribe, I need to see you back in about 5 weeks. We're going to talk about what got better, what didn't get better. And then based on how you feel, I might change the dosages around. But once we get it right, once you feel the way you want to feel, then maybe every 6 to 12 months, I'll need to see you. If I prescribe testosterone, it's a controlled substance, so it's always good to touch bases every 6 months. And that if you ever, I'll tell patients, if you ever feel like you want labs done or that you're feeling off, reach out through the patient portal. I answer those at the end of the day. You can call the office. The girls usually answer the phones all the time, and they'll give me the message. So you always have access to care. It shouldn't be that your provider is so busy that you can't get into treatment. The girls that work for me, they come into my office all the time. Some lady is having bleeding and she's 55 and I don't have an appointment for 3 weeks. Well, I'm not going to make her wait. I'll overbook her. That's how it should happen. That's what you have the right to. To receive appropriate assessment of of and treatment for pain, meaning, and this happens to women all the time, it's been studied that women that go to the emergency room have an 18-minute delay in the time that they receive pain medications from men. This has been studied, which just goes to show you that women are treated as second-class citizens by the healthcare system, if you needed any more evidence of that. And they are even treated, if you think about it, the word hysterectomy, the hysterectomy means to remove. Hyster is from the word hysteria. And so back in the days, thousands of years ago, a hysterectomy, we thought, not me, obviously, or my colleagues, but we're talking in the time of Socrates, probably. They thought all of a woman's hysteria came from her uterus. Great. And maybe some people still think that. Not a good way to think, but that's what they thought. So the word uterus is hist, comes from the Greek hysteria. Not a good thing. However, you should know and get treatment for pain. You should be listened to if you have pain, and you shouldn't be minimized. One of the reasons that I have a good story, there was a drug rep when I practiced in Tucson, and she was a young woman. She was probably 35. She was at a doctor's office across the street from the heart hospital, and she started having chest pain, and that was radiating into her left arm. She went into the heart hospital and told them, I'm having chest pain, I'm having pain in my arm. And they basically told her she's too young to go home and take a bath and relax. She went out into the parking lot and had a heart attack in her car. Now, luckily, she survived and she didn't have any horrible damage. But this is a classic example of not being treated appropriately for pain, and to be treated appropriately because of your gender. That stuff should never happen. You have the right to refuse to participate in research. You have the right to refuse medical students, residents. You always have the right to have the people that you want in the room. So like, I teach a surgery called Accessa, which is for fibroids. And sometimes I'll have doctors come to visit me and watch the surgery, or I'll go and train another physician in another city. You as the patient have the right to not have other people in there. And we should be asking you, do you mind having a medical student? Do you mind? I've had medical students in my office before, and residents. And occasionally I'll get a patient that just doesn't want them in the room, and that needs to be respected. It doesn't matter if it's for an exam or if you're just talking. You have the right to refuse research treatments. You have the right to refuse medications, the treatment plan. You have a right of refusal. You have the right to be transferred to another facility when your participation in the clinical center is terminated. I have a lot of people that maybe aren't super happy about their care. They want to be transferred to another facility, or they might see a doctor who they're not happy with and they want to go to another physician. And sometimes it's really difficult. The office won't release your records. They will drag their feet. That's not right. That's unethical. And you have the right to transfer your care if and when you desire. You have the right to expect a medical summary from every clinical center you're associated with, and that will be sent to any physicians you designate that to. So you should be given access to your notes from office visits, your operative report, your pathology reports. You should have access to all that, especially in this day of electronic medical records. It's so easy to do that. And then finally, you have the right to designate additional physicians or organizations at any time to receive medical updates. Meaning, if I send somebody to a cancer surgeon, they should be updating me with your care plan. And if they're not, and you request that, they need to do it. That's an example, and it doesn't happen all the time, but occasionally, they may forget to send you a copy of their care plan or something like that. So you have the right to designate a physician or somebody else as a proxy for you. So keep in mind, with office visits with physicians, and especially in this field of hormone replacement, because women are getting gaslighted all the time, you have rights. You have the right to be treated fairly and appropriately. You have the right to order labs. You have the right to request labs, and the doctor can refuse. They can do that. and that's not illegal or unethical. Maybe they don't agree with it, but you certainly have the right to ask for it. And eventually, if you do this, and this is something that I just talked about today on YouTube, don't give up. Don't give up on yourself. Don't give up on your cause, because while one physician may decide they don't want to do something, another physician may easily order them. I have people come to me all the time and want labs that I don't usually order. Classic example is a reverse T3. I don't think it's super helpful, but I'll order it if they want me to. It's no skin off of my back to order a lab. So keep in mind that you are your best advocate. You are the person who is going to get things done. Now, if you're a minor or if you have somebody that has power of attorney, then obviously they need to. I have a patient who has Alzheimer's, early onset dementia, and her husband does a lot of the speaking for her, but she's there enough to agree with the plan. And I still talk directly to her because she's my patient. And then I'll loop him in on the conversation as he's sitting next to her. But you have the right to all of the information. So I just wanted to pop in and make this a quick one, easy to listen to. Remember, the first place to start with hormone replacement is educating yourself. And the best way I can think to do that is by using the Hormone Balance Bible, the book I wrote. Imagine that. It talks about the 12 most common hormone imbalances in women. It talks about how to fix those with my Shines protocol, which is a 6-step process, only one of which actually includes hormones. So there's 5 things you can do. You can go to my website, tassonemd.com/quiz, take my quiz. It will give you the hormonal archetype that best fits the way that you answered your questions. And it's not as good as having your labs done, but at midnight when you're home and you can't sleep and you've got things going on and you're frustrated, it's a good way to get started and just get some more information. I'm in practice in Austin, Texas. I see patients Mondays, Tuesdays, and Wednesdays. If you would like an appointment, my office phone number is 512-956-0296. You can find me on Instagram at Shawn Tassone MD. I post on there daily. I also do a Q&A session on Saturdays, so if you'd want to ask a question, obviously I can't answer personal medical questions, but I can just answer generalized things, as I can't give medical advice over the internet because that wouldn't be acceptable. I'm licensed in about 27 states in this wonderful country. If you go to my second pinned post on Instagram, I have all those states listed. I will soon, and then probably the next 2 weeks, be adding New York. But I'm in California and Florida and Texas and Washington, D.C., Connecticut, Kansas, Louisiana, Maine. I'm all over the place. But you can always call the office and see if I'm licensed in your state. And if I am, then I can see you. We'll draw some blood. We'll get you on the road to feeling better. Have a great day.